The Local Show, sponsored by Victory in Motion, home of knee repair, not knee replacement, on News Radio 570 WSYR, on 106.9 FM, and live everywhere on the iHeartRadio app. The Local Show features in-depth conversation with business owners, employees, and influential business leaders throughout Central New York, exploring their successes, challenges, and reasons for doing business right here in our growing community. The Local Show is produced locally by Zoe Advertising. Now your hosts, Tom and Steve.
All right, we're back into it, back at it. You've got the best time spent on the radio that you could possibly have with Tom and Steve.
Yeah,
right
I
here
can't get any better
on the
than this
show. And on YouTube as well, you can see that.
Sure.
There's going to be some interesting video, I think, that Nicholas is going to take of this wedding reception today.
I was just going to ask about Nicholas.
It's our bride and groom own Skydive Seneca Lake.
Okay, I'm
and
imagining
they're out of
something
Ovid.
of great altitude.
Yeah. So when they come in, before they do their vows, of course, they're going to be jumping out of a plane with their entire wedding party.
So are you or Nick jumping with a GoPro on your head to follow them down or anything?
But I'm sure that Nick will be taking some pictures of that. And then when they land, then, of course, we'll do their vows and, do the ceremony and everything like that. And then we're over to Ginny Lee.
Oh, okay.
The Wagner Winery right there on Seneca Lake. Beautiful place.
I told you my wife jumped out of a plane once.
You did, yeah. I think that was because she was going to marry you, or she married
it was
you.
after she married me.
I'm jumping.
We were having some marital conversations, and her and her friend, she says, that's it. And they said, we're going to go do something. And she went, and her friend, they jumped out of they do it tandem. They hook you up to somebody that apparently knows how to do it, and you trust them with your life.
Not my bailiwick.
Yeah, no, not mine either, Tom. I'm staying in the plane.
But
thanks.
it'll be fun to DJ there.
You won't even get in the plane, let alone jump out.
Yeah, forget that. All right. It's a pleasure to bring back a guest who I think we had you on about 3 years ago. It's Marissa Vartak. She is a NP and owner of On Care Family Health up there in Cicero. How are you?
Wonderful. Thanks, Tom. Thanks for having me back.
Yeah, it's good to have you back. Quite a bit of a buzz around town about how well you've been doing over there. You not only have Cicero, but you have another place too now?
So we were on about 3-4 years ago. We started right across from Cicero Elementary.
Yeah.
And we just outgrew that location. So we actually moved down the road to the Cicero Professional Building right across from Spira's on 31.
Wait, by the miniature golf course?
Yeah.
Okay, how about that?
Well,
people know that.
I just live over in the pastures,
Oh,
so
yeah.
I'm over at Spira's 5 times a week.
We are too.
Yeah, it's wonderful, isn't it?
Yeah.
I thought you were going to see it at the miniature golf course 5 times a week.
Yeah.
You must be pretty good at that, Tom.
And that Cicero Professional Building is very nice.
Yes.
Yeah. So that's great. You've been over there. What has been happening since you started? How have you grown? Is it you and 4 others, 3
Yep.
others?
So when I was on the show with you guys a few years ago, it was me and a nurse and I think a receptionist, family practice ages 5 and up. And we just continued growing, bringing exceptional care to the community. And so we're still doing family practice ages 5 and up, and we have a total of 4 nurse practitioners now.
Oh, that's wild.
Yeah.
Beautiful. So needed, especially in the Cicero area. And now with Micron and everybody coming in, goodness gracious.
Yeah, absolutely.
Yeah, hard to keep up. So where's the other location going to be then?
So the first location that we started, we still have, but we were fortunate enough to rent it out.
Oh, I see. Okay, gotcha.
Okay, so you're in one location right there.
Right now, we've moved everything to our larger location, and we're actually starting to outgrow that as well.
That's a good problem.
There'll be some exciting news coming. Maybe we can share that in the fall.
That's great. Right near the Holy, there's a traffic circle here now.
Yeah,
place.
there is.
And for years, that was my territory. You hit that like, they don't call it a circle, it's a roundabout, right, Tom?
Right, yeah, the roundabout is fun.
So are people still getting sick? What's going on?
Yeah, I think people are just really starting to focus on their health in general with not just in the importance of family history and genetics, but really taking a look at, am I doing everything I should be doing to make sure, because patients are living longer and longer. People live longer and longer now, so.
Does it make you nuts when people go, I Googled it? Or is that help or hindrance? Well, I was looking up and my left earlobe hurts and I got a tingling in my elbow and a runny nose, so I've got some strange disease. I mean, you must get that constantly.
All the time.
All the
All the
time.
time.
So
Yeah.
how do you handle that? Not go, Okay, we'll look into that. Now, how do you manage that? Is it hard?
I just let them talk.
Oh, okay.
I just let them talk because that's how I handle it, and then I talk to them about what I think is going on, of course, and often, when I'm trying to educate a patient about something, I'll recommend that they go look it up because they're going to do it anyway.
Right,
so
yeah.
I say, what chatbot do you use?
Yeah.
Do you
Okay.
use?
Very good.
You actually asked. That's smart,
I
though.
do.
It's good, yeah.
And that's one of the biggest things that I do when I talk about our Softwave therapy for pain because it's something they've never heard about and it's something that nobody's ever offered them. And we have it right here in Central New York. And they kind of look at you like, this is really going to work. And what do you mean I don't need surgery? So I hand them our brochure and I say, I want you to go home and type this into ChatGPT or whatever AI bot you use, and I want you to read all about it.
Okay, so what is Softwave therapy?
Talk about it.
Tell us what that is.
Unpack it.
Yeah, there we go.
So Softwave therapy is what we have been able to bring into the clinic for patients with pain, whether it's back pain, shoulder pain, neck pain, hip pain, knees.
Wow, Steve, that's
Feet.
right up your alley.
She talked to everything hurts, so at this point.
Arthritis, just in general, we're healing wounds, we're healing fractures, we're doing ACL tears, rotator cuff
Really?
tears.
Yeah.
So what
Without
it does,
surgery?
Yeah, and it's what all the NFL teams are using. So in our Softwave rooms, we've got all the NFL memorabilia. We've got the NBA teams. The New York Knicks have 3 in their locker room. So this is what our pro athletes are using to heal themselves. They're not getting injections. They're not doing surgeries. They're on the field, all the time. So what it does is it stimulates your bone marrow to actually regenerate stem cells and bring stem cells to the area to heal that tissue. And it's incredible for pain. So patients who have been told you need back surgery or you need knee surgery or you need shoulder surgery or hip surgery,
Yeah.
try this first. Yeah.
So are you rubbing a wand on, or is it like a
Yeah,
laser?
it almost looks like an ultrasound machine.
Oh, there
but
we
what
go.
it is it's electroacoustic sound waves, and they're light waves, and we can penetrate 12 centimeters right to the bone. So it's about the size of a soda can.
So what body parts does it work on? You
Well,
mentioned
she
a
just
whole.
said,
I
yeah,
know,
a
but
whole
you
bunch.
mentioned like a whole bunch of them.
There's not much it
I
doesn't
mean, if
work
someone has
on.
headaches, you don't stick it on their head, right? And
No, but it's actually in trials for Alzheimer's dementia right now to decrease amyloid plaques in the brain.
Oh, my
which
goodness.
is incredible. Yeah.
okay,
Yeah.
mostly joints. Is that is
Joints, tendinopathies, yes. But any joint. We've done hips, backs, necks, shoulders, elbows, wrists,
And you're one of the few places that do it then.
Yes.
Yeah.
Yeah.
How come it's not like on every corner and everybody's doing it?
It's not covered by insurance. It's German
So-
engineered.
Okay.
And so, but I always tell my patients, and that's what they like about us is, we're not big pill pushers either, but, sometimes what's covered by insurance isn't what's best for you.
Would this just be for old people like Tom and I, or well, I mean, if a child has or a kid has something, it's
So it's for anybody ages 18 and over is what it's been FDA approved for. For somebody who doesn't want to do something invasive, doesn't have time to be out of work, and, surgery is not going to fix everything. We're doing a ton of post-op patients, believe it or not, who failed surgery. But also for our patients who are elderly and should not be taking things or doing invasive things to protect their kidneys, their liver. They shouldn't be going into surgery. They shouldn't be taking drugs. But then there's a whole nother realm that I could get into, too, about how we've helped patients with chronic pain and helped them come off of morphine and methadone, which is a huge passion of mine, too, because I have something that can now fix your pain. The other issue to that, though, is we have to dance with the devil a little bit with your addiction.
Oh,
yeah.
yeah.
Well,
Yeah.
it sounds like you're having the courage to do that, though.
Absolutely.
Some people are like, oh, here,
Bring it on.
Take a pill or take another. I mean, you said methadone. That's a drug you use to get off of other things, right?
Yeah.
I mean, it used to be. Is that still true?
Used to be. That's and it's not. It's not a good alternative in my opinion.
Okay, well, let's talk some more. I guess you won some major awards. We'll talk about the next break. So, Marissa, owner of OnCare Family Health, OnCareFamilyHealth.com. Did I get that right?
That's right.
That's it. Let's go to the break, and then we'll talk some more after the break, okay?
Thank you.
The Local Show, sponsored by Victory in Motion, home of knee repair, not knee replacement. On News Radio 570 WSYR, on 106.9 FM, and live everywhere on the iHeartRadio app. The Local Show features in-depth conversation with business owners, employees, and influential business leaders throughout Central New York, exploring their successes, challenges, and reasons for doing business right here in our growing community. The Local Show is produced locally by Zoe Advertising. Now your hosts, Tom and Steve.
Thank you for stopping back on The Local Show with Tom and Steve, the last bastion of good quality talk radio.
The last bastion, Tom. It is. There are no others.
The big scoop on all the different businesses that are around Syracuse. We've been talking with Marissa, who is the owner of On Care Family Health, and she's not only an entrepreneur, but she's also an NP, so highly educated and also, you know, an entrepreneur. That's a hard balance, isn't it? That you not only do you have to care for people, but then you also have to run your business.
Yeah.
How do you balance that?
It's the grace of God, honestly.
Yeah. You got to hire people sometimes.
Yes. You
gotta say
delegate.
goodbye to people. It's just the world.
We've had our share of that, too.
You know,
Right.
and which is the nature of the beast. But you're right, Tom.
And
You're a business person.
Right, it's a balance.
And you're a
that.
physician, but now you got to...
Right. Well, and now you've done that successfully because you won some awards, and tell us a little bit about that.
So we got the #1 primary care in 2025, and that was through Syracuse Community Votes. So that's the people voting.
Yeah.
And we were up against a lot of bigger practices in the area, very well-known practices. But we really strive and focus that our practice is very patient-centered.
So right now at On Care Family Health, you're taking new patients still?
We are taking new
So
patients.
somebody goes, I need to go somewhere. I need a family.
Yeah.
I don't know where. Because that happens to a lot of people.
I have a daughter and a wife who desperately need that, and you know, but right in our area because they're traveling all over the place. And you know what? They're not. A lot of these places are not patient focused.
No.
You said that, and I don't think that can be enhanced enough. That if you are truly patient oriented, that is different than what other people are doing because they can't get into any other places.
Well, not only that, so maybe I'm wrong, and I'm wrong a lot. They run into urgent care or the ER.
Right.
They got
a sinus infection, and they're going. Yeah.
So now they're going through those things, but they're not connected to a practice, right?
And I think when I spoke with you guys both a few years ago, I really, really meant it, and I'm very happy to say. And I was thinking about that today before I came in. What am I going to say this time? And I'm really happy and proud to say that I've kept my mission statement. Your health, our mission. What I focused on a few years ago with you guys is the importance of keeping their care in office, not having them go to urgent care. I don't like my patients to go to urgent care. Even today, when today is typically my day off, we had 2 or 3 people call this morning and they said, what do you want to do? I said, tell them to come right over. I'll make it work.
Who does that anymore?
I mean,
who does that? Who does that?
Nobody.
And you asked when we're accepting new patients. I want to say, I'm trying to remember when we spoke last time. We were out, I want to say like a month or 2 to accept new patients. It's been almost 5 years. We've grown to 4 providers, 12 staff members, okay, on top of that. And I'm proud to say today, I can still get you in a couple months.
And do you spend time with people rather than, you talked about earlier when people are, asking questions and saying they're researching, and you allow that conversation to take place, where a lot of people, providers, will just kind of cut them off and say, look, they get offended. And it's like, here, take this pill, talk to me later.
Yeah.
This is your only option.
They get offended. I've had patients tell me that providers have walked out on them.
Yeah. I've heard that.
I teach all of my providers. I don't teach my providers that at all. We are very patient-centered. In fact, I tell them every single day, if you just sit down and listen to them, they will tell you what's wrong with them. All you got to do is listen. They're going to tell you what's wrong with them.
Yeah. And if like my mom, they're going to tell you, use a lot of words. So are you able to stay on schedule? Because that's hard. Because your heart is there. You want to be able to hear them.
Yeah.
They Googled it, and now they chatted it or whatever.
Yeah.
Choose
and TikTok too. They
Oh, no,
they
that's
want
horrible.
all these things checked, and it's
Oh,
like
no.
you just have to educate them.
Yeah.
But it's about building a trusting relationship with these patients, which you're not going to do on the first visit, but you
Right.
do over time, and they do. They really trust you, and they trust our providers. But it is about listening and being there. And we open up sick visits every morning. We sit down the NPs and we look at our schedule every single morning, and we all open up sick visits.
What does that mean?
Means we go up to the front desk and we have a whiteboard and we put on times. And the minute that phone starts ringing at 8 a.m., the receptionists start crossing off the times.
for
of the
folks that are your patients.
Yeah.
So getting someone in might take a month or so because you got to get them into the system.
That's why we do it that way. See, these other practices are doing it wrong. You can take new patients, but if you can't care for them, what's the point?
Right.
So you need to be able to have enough visits open for the
I see.
patients you currently have, because what's the point if all you're doing is seeing healthy people?
So is a sick visit like somebody wakes up with, horrible
and
sinus
they're
pain?
sick.
and
And they're
Could be
sick.
anything.
Yeah, oh, it could
Today
be
for
anything.
me coming here, it was shortness of breath, pneumonia, urinary tract infection.
And you came anyway.
Yeah.
No, I'm kidding.
no,
I'm
she
telling you,
doesn't
that
have
was,
it.
that was a joke.
That's not her.
That was a joke. You missed it.
Good golly.
So there's sick people all the time.
Yeah.
Now, summer, less sick people in the summer? Say yes, maybe?
Maybe. Just depends.
you
You
know?
know, it's
Yeah.
and it's everything in primary care. A lot of mental health lately, actually.
Well,
Yeah.
that's a big...
So you take care of that? Mm-hmm. Okay.
Yeah.
I don't know many people who do that. Primary care is it?
You have to
Focus on
You
that.
know the patient the most. They come to you for everything.
Yeah.
Patients come to you to clear them for surgery too, by the way. And you drive the
That's right. Yeah,
the train in primary care.
Wow.
Everything goes through you.
What else would you like to talk about relative to your practice?
I have a question, Tom.
Oh, go ahead.
IV hydration. Okay,
there you go.
you got to help me because that just seems like I can't
the
quite
vitamin
grasp it.
B and
I
the
know, but
electrolytes,
I can take a pill. What is this?
No.
Help me
look,
understand this. I'm a
that's-
basic guy here.
We practice Western medicine, but like I said before, it's about your body can do some amazing things, right? We just got to show it how. And so IV hydration is one of those things where it's very new to the medical field. It's so needed. It's natural, especially patients going through changes in their life, like even our postmenopause females. They don't get enough attention, and there's a lot of things we can help their symptoms with IV hydration. Patients who have a lot of GI issues, we can help them.
So this
Patients
isn't
with migraines.
Wait, hang on. So this is just giving someone IV. You're putting special stuff in it?
It's not like just drinking an electrolyte.
Right. The problem is when you drink something through your gut, you're going to absorb about 20%. There's too much acid in your belly, okay? When you have an IV hydration supplement, it's 100% absorption immediately through your veins.
And how long does that last?
3 to 4 weeks.
Oh,
And
okay.
is it just one formula, or do you do vitamin
We have
D?
12
and-
sening formulas that you
Okay,
can get
gotcha.
based on your symptoms. So for even brain power, focus, energy, weight loss, hangover relief,
Tell
of
me
course.
about headaches for a second, because I know
Yeah.
that's a thing, and I know someone personally, me, that struggles with that. How does that help?
Because you're getting, first of all, most patients who have chronic migraines are just chronically dehydrated, no matter how much water they're intaking.
So that's the common denominator.
Yeah, and also there's supplements in there that will help. Magnesium and different electrolytes that will help.
So most people that have migraines are dehydrated. And I never knew that. And I go through waves where I don't have them at all, and then they show up, and then they're gone for 6 months. It's odd, but this is interesting. I saw that, and I had to ask you about that because I think that's pretty cool.
Yeah, and you don't have to be a patient, by the way, to do our IV
okay.
hydration or the Softwave therapy we do for pain.
Gotcha.
So those are things that you can just sign right up for and get right in.
Well, so here's an office right in Cicero, by the way, it's way this side of Micron, so you don't have to get tangled into that.
Exactly.
And
it's across from Spiro, so you can go over there and then go back and go get some
That's
lunch.
right.
I play some miniature golf at Big Don's or Al's or whatever that place is there on Route 31. So On Care Family Health, did I get that right.com. You can sign and find out some information and find a place where you can connect. Kind of like it used to be way back in the day where they know your name or something like that, right?
Yeah.
Awesome. Marissa, we appreciate you joining us. Thank you.
Thank you very much.